show you a ball rolling session that's great for hip. We're going to start with the IT band, and then we'll go to adductors, and then we're going to do deep lateral rotators of the hip. And I would definitely do the deep lateral rotators always last in that sequence. Okay, so we'll start with IT band. IT band starts on your top of your pelvis, so your ASIS, that kind of bony prominence. It's going to go down the side of your leg, past your knee, and attach down on your tibia. And so with the ball, we're going to be starting at the origin on the pelvis, and we're going to slowly be going down that line, but we're going to be cross-frictioning the fibers of the IT band that's attached to the lateral quad and the lateral hamstring. So we want to make sure that we get that whole side to side and get all of those attachments into those two muscles. So you're going to start, and you want to have some room to move up. So you're going to start at the bottom of your mat. You're going to put the ball on the side of the pelvis there. And you can even roll forward a little bit to get onto that iliac crest there and the ASIS. And you want to just kind of stop, breathe. Think about letting the ball sink through the tissue towards the bone. And you don't want to rush through this. You do want to take your time. And then roll so that your hips are square to the wall in front of you and they're stacked. Okay. This top leg can be bent so the foot's flat. You're going to make a little micro shift up so the ball's rolling down the pelvis. And then you're going to roll forward slightly to get the anterior part of or the front side of the band. And then you're going to slowly roll back and tilt the pelvis towards the ceiling a little bit. Breathing and sinking. So I'm actually going a little faster than you will go. But that's just, I want to give you where you're going and why, but you'll probably go a little bit slower. Then you're going to make another little micro shift up, and you're going to roll forward, and then you're going to slowly roll back. And remember, if you find a spot that's particularly sensitive, you want it to hang out there as long as you can, but always listening to your body. And then you'll come back to center, make your little micro shift up, roll forward, roll back. Again, I'm going faster than you will go. Back to center, micro shift up. And again, your foot can kind of follow. And back, that's the top side one that's stabilizing you. And right here for me, I get a little sensitive spot here. And then rolling back. Okay, so we're gonna keep going, right, all the way down till you get just above the knee. You will not go onto the knee joint. So we are not actually tracing all the way to the origin. When you get right above the knee, you're gonna roll forward, pause, and then you're gonna come back and roll back up towards the ceiling, okay? And then back to center. So again, remember, you're not going onto the knee joint. Then we're gonna do adductor, okay? So adductors start on the pubic bone, all the way go down to just past the knee. Again, you'll not be rolling over the knee joint. This one, you're gonna be moving side to side. So we're gonna start on one side, moving towards the other side. You're gonna bring one leg out to the side. The ball's gonna go right on the pubic bone, okay? The leg that you are not rolling out is straight. The leg that you are rolling out is bent, and you wanna try to bring that knee up to actually let me do the other side so you can see it better. Okay, so this is the leg I'm working on, and I want that knee about even with my hip, if you can get it there, okay? You're gonna come right up so that you're on the pubic bone, right on the tendon attachment. Breathe and sink here. Okay, so you may wanna hang out here for a little bit. This is a good place just to kind of do some breathing, holding here. Then what you're gonna do is think about pulling the pelvis to the left. So you're gonna pull the pelvis to the left, and then the ball is gonna roll out the inside of your right thigh, okay? So if you can almost think of like a wishbone, you hold one side, you're pulling the other. So we're gonna shift the pelvis left, roll out the right leg. Again, you're gonna go a lot slower than what I'm going here. Pull the pelvis left, and then shift the ball out, that micro shift. Abs are on here so you're not collapsing into your lumbar spine. And so you're just gonna kind of keep that shifting across the mat, pulling it out. And again, the back leg can go down. If you feel like you can't, you're getting a little tired, you can put that leg down, but then see if you can bring it back up, because it is that pulling of the pelvis to the left. And then once you get all the way out there, again, I'm going faster than you'll go, you can do a little bit of a rolling motion here, right on that very last bit of the adductor before it gets to the joint. Okay? And remember, I'm only doing one side, but you are always, always, always going to do both sides. Okay? If you do one muscle group, you have to do it on both sides. All right, so that's your adductor. Deep lateral rotators, you're going to take your smaller ball. We're going back into that side position. We're basically going to be going from the top of your pelvis and the greater trochanter of your femur, so that little bony spot in your hip. The ball is going to go right in between there, and then it's going to go around that greater trochanter. We're making almost like a C shape around that greater trochanter. So you're on your side, okay? And then here, this one is more of a, you're going more from your side to, you almost be moving into a sitting up position. Now this one does have a little bit of a movement with it. So you're gonna get that ball right onto the iliac crest there, or not the crest, the iliac fossa there. And you're gonna lift the bottom leg. So I'm lifting, reaching that leg out of the socket, holding here, and then exhale. Let go, and then sink. Let go of the tissue under the ball so you sink even more. Okay? And then we're gonna lift, exhale, lower, and then you're gonna make a little shift. So I'm rotating my pelvis towards the ceiling. I'll feel the ball roll back. I'm gonna exhale or lift. Exhale, release, and let go. So I'm very intentionally thinking about the muscles below the ball, just letting go, the ball sinking deeper towards the bone. Again, I'm moving faster than you will. Again, a little rotation, a lift, exhale, and release. Okay, a little rotation, lift, exhale, and let go. All right, so now I'm bringing this leg to the same side, and I'm gonna start pulling back a little bit. So I'm starting now to come down the hip. I'm still doing the lift and lower, exhale, release. Good, so now I'm moving to the back side of that greater trochanter. So the greater trochanter is just in front of that ball. And now I'm gonna start to come up, lift, exhale, release. Good, now the ball is coming between that greater trochanter and my sacrum and sit bone. Lift, exhale, release. I'm pulling back now more than a rotation. Lift, hold it, exhale, release. Pull back, lift, hold it, exhale, release. One more little pull back so you'll come all the way up to sitting. Now again, you're kind of sitting on more of that left side, so you're not square. And remember, you're never gonna let the ball go right on your tailbone. Lift, lower, release, okay? And you're done, okay? And you're always gonna do both sides. Okay, so that's your ball rolling program for hip health.